190,000. That's how many people in Africa could die of coronavirus in just 1 year, according to the World Health Organization. A study by the WHO says up to 44 million people on the continent could get infected during the same period. WHO's technical officer, James Avoka Asamani, explains the conclusions of that study.
This study is a predictive modeling that explored the potential effects of widespread community transmission of COVID-19 in the WHO Africa region. So what this study has done is to look at the spread of COVID. There are essentially 4 different scenarios. One scenario is where countries have no cases, but they have a risk of importing cases. Another scenario is where there are sporadic cases that are normally those that have been imported, cases imported and their contacts. Another scenario is where there are clusters of cases, where the cases are coming from defined geographical locations or the small clusters. And the last scenario is where there's established widespread community transmission. In this scenario, the cases are all over the country, they are not connected to each other, and it's much more difficult to trace the contacts. So this is the scenario. The last scenario is what this study is about. So in this study, what we have done is to look at country-specific risk factors that would expose the population to COVID-19. And we looked at, we use actually country-specific data that is looking at the peculiar situation of the Africa region. We considered several factors, and we grouped them into basically 4. One of it is what we call the gathering factor, where we actually looked at what are the household sizes, the schools, the population in urban slums, population density, how are the population crowded, because crowding is one of the vehicles of the transmission. The other one we looked at is what we call the transmissibility factor. How easy is it that people can move from one place of the country to another, such that if they are infected, they can easily spread it? So connectivity in terms of the cities, road, and ease of transport. Another critical one was also what we call the hygiene factors. So we looked at what proportion of the population have access to at least basic sanitation, because hygiene is one other aspect of the transmission. And then we also looked at the possibility of whether having a protective effect or otherwise. So these put together, we came up with what we call the risk of exposure for every country using the country-owned data. And so countries had different risk level of being exposed to the virus. And when people get the virus, we also looked at very specific indicators that look at vulnerability, how many people are living with HIV, population who are older than 60 years or older, those who have chronic conditions like diabetes, among others. So putting all of these together, we found out that in the Africa region, which is made up of 47 countries in continental Africa, we found out that the risk of exposure actually varied widely between 2% to about 46%. That is to say that the population in some countries had very low risk of being exposed to the virus, while in some countries the risk was really high. And the top 10 countries with the highest risk were mostly made up of countries that had small in sizes. The countries that were large and were in this group included South Africa, Cameroon, Algeria, Nigeria, among others. So the top 10 had Cameroon, Nigeria, and Algeria as the big countries. But if you go down further, you include Nigeria and other countries in there.